Hello, everyone. Today I'm going to talk about our belief systems, whether our beliefs have a role in pain management or not. And I will share some highlights. How does belief systems can help us modulate our pain, and what are some factors that goes in belief system, and how we can modulate and use belief system in our favor to reduce pain. So belief systems and patient provider relationships are very, very important in patients' pain management. So I'm going to share with you one article that I came across in the past, which explains about role of patient treatment belief system and provider characteristics in establishing patient provider relationships. We have long known that patient provider relationships have been associated with positive treatment outcomes. But how does it really help? How does it help in reducing pain? How does it help patients coping their pain? What are the behaviors they adopt in modifying and modulating their pain that we will discuss about? As we know, pain is a very complex, multidimensional experience, especially when it comes to persistent pain. It is complex, multidimensional. There are several factors that could affect, stemming from the interrelations among biological, psychological, social, and spiritual factors, so and so on. So, one of them is the belief system. Our belief system is known to modulate pain. And what they say is when patients who come to see us for treatment, when they believe their provider is respectfully able to listen, promote, and facilitate therapeutic treatment, research says it helps to promote openness in relationships, creates better open dialogue in the treatment rather than the one-way communication. That helps to develop a bond, a therapist and a patient bond, leads to greater trust, and that's how it helps in assisting in relieving pain. And that's where they say belief equals pain relief. Then comes the shared decision making process, listening actively to the patient, listening to their story when they come in rather than a particular joint that we have to evaluate. For example, if someone coming in and we are assessing a shoulder joint, it is just a shoulder is a part of the body, and a part of the body is a patient's life, and life is a part of a lifestyle. Listening to their story, how that impacts their life is very important. Listening actively, showing empathy and compassion towards their story, their problem. And that's how we develop a caring attitude or caring relationship that patients are looking for. This helps to develop an open dialogue. It helps to create a flow of response that patients are looking for. And remember, when it comes to chronic pain, patients who have difficulty managing their pain, they often express or often deals with emotional repressions where they are not able to express their pain to anybody because they are tired of telling their stories repeatedly to their loved ones or to their doctors or to their clinicians. Allow room for those conversations because it not only increases the trust between client and therapist, but it also facilitates the healing process. Then comes to the Alliance for Safety. As I said, there's plenty of research that talks about people who have persistent pain. They have a they have a problem where they don't like to express their emotions. They pull back, they hide their emotions. What happens is they slowly isolate themselves, and because of this isolation, there are several other factors that comes in like disuse, depression, and other psychological problems. And this is where we come in handy. We need to create a therapeutic alliance for and therapeutic alliance emphasizes that what patients are expecting out of us rather than what we think for them. That's where their belief systems are important. If they feel certain activities are painful, how can we modify their pain behaviors? How can we modify their cognitive strategies where they don't feel threatful in doing certain activities. If you see patients who have persistent pain in their back, and if they feel bending forward increases their pain, and if they're seeing someone doing the same activities, that they think there's a credible evidence to reproduce the pain. Neurons that are wired together fire together. So when they see someone doing that, they feel the pain too. There was a research done in Berkeley on patients who had persistent pain, and what they were shown is they were shown two different types of movies. One that was very violent movie, and one was a very comfortable, soothing, happy ending type of movie. So what they found out, when the patients had pain and they were shown that violent movie, they were running the same circuits that they found in functional MRI by scanning their brain when they were in pain. When they saw the violent movie, they were running the same circuits, they were activating the same areas in the brain. However, when they saw a nice, comfortable, happy movie, what they found is quite a few areas in the brain were not getting activated, which they saw in a violent movie. So therapeutic alliances matters a lot because we are trying to place the patient's belief at a priority, which helps them feel safe that we are listening to their story, we are interested in story, and we are trying to find a way to help them, which helps to create an open path for a dialogue. Let patients express. We should listen without being judgmental about their experience. They have developed their own experiences by doing things. And when we listen to them, when we make sense of their story, these are the subtle signs that helps us to gain their trust, which is very helpful in creating a positive treatment environment. So that brings us to the concept of RAIN and how we can implement this concept in modulating their pain and challenging their belief system. So when somebody is having pain for a long period of time, we know there are other complicating factors that get associated with it. Many times these patients also have anxiety. Many times they have depression. They can't deal with their pain. They have frustrations. They have quite a bit of emotional issues with it. They are tired of this pain. Family doesn't take the person very seriously. They are tired of person having in pain, not able to contribute financially, not able to contribute in the house. And then it takes a toll in general on the person, on the family, and so on. There's a dissatisfaction at work itself because they can't focus on it. And the idea behind RAIN is where R stands for recognizing what emotions somebody is going through, what kind of thoughts that is coming in their mind, or what kind of experiences they are going through. Somebody who has anxiety and chronic pain, they might feel they might have some cognitive restructuring. I'll give you an example. Let's say if my boss is unhappy one day and he gave me some tasks to finish up, which I couldn't do it timely, and my boss was unhappy with me. So what I would do if I have other problems such as anxiety or chronic pain, my thoughts will go haywire. These are like thought viruses. So what I would think is I would make illogical connections. Why and how? I would think my boss is unhappy. He will not give me a raise coming up next year. I will be fired from my job. I will not be able to pay my mortgage. I will not have a house, and I'll be homeless. Boom, my life is over. I'm done. Now these are all thoughts. My boss hasn't fired me. This is not reality. But patients who deal with anxiety, depression, or chronic pain, they deal with these thought viruses. They don't have control over their negative thoughts. So what and how we can train them is by teaching them recognize the emotions that they are going through. Remember, we cannot control the thoughts that come in our mind, but we can modify and act the way we want to the thoughts. So once we recognize the experience that we are going through, the next step is acknowledging and accepting it. And when I meant accepting it, it's not accepting the way I am right now and that's it. It's basically accepting it and committing to it to deal with it positively. This step is understanding about the problem they are in, about the experience that they are going through, about accepting and understanding what their body is going through, and trying to be present in what is happening. So when I said my boss is unhappy because I couldn't finish a task that I was given, so trying to be present in that moment, like my boss is unhappy because I couldn't do a job. Now, what are the other ways I could do? And so that brings us to the investigation. So when we acknowledge and accept it, my boss is unhappy, and rather than going to the negative thoughts, we can start thinking, we can teach our patients, yes, I feel that my boss is unhappy. Now I have a thought that I may not get a raise. I have a thought that I may get fired. So what happens when we start to think about this, that I have a thought that I may not get raised, or I may have a thought, or I have a thought that I may get fired. So what we are doing is we are trying to breaking down between a reality and a thought. We are telling our brain that I have a thought rather than being it a reality. So what do we do by this? We are preventing our limbic system getting hijacked. And we have long known that our limbic system plays very important role in our emotional responses. So patients who have anxiety, depression, or chronic pain, their limbic system is on high alert. They are constantly on sympathetic overdrive. So what do we do from there? Then we go to I, that is investigation. And we teach our patients, like, what is it like if you would stay in that moment? Take a step ahead from acknowledging it. Yes, I feel that my boss is unhappy. Yes, I feel that I may not get a raise. I may get fired. So what can I do to change the situation? Rather than my boss is unhappy, I may not have a job, I may not get a raise, I will get fired, boom, I will not be able to pay mortgage for my house, and I'll be homeless, and so on. So what we are doing is we are rationalizing our thought process. We are rationalizing what positive changes I can make to help improve my relationship with my boss. So similarly, patients who have chronic pain, we can teach them, yes, I feel pain. So what can I do to change my pain experience? Is there anything I can do positively? What are some positive behaviors or coping strategies I can use to reduce my pain? And that's where we try, and this is how we train the brain to prevent limbic system hijack. And sometimes this system may not work effectively, and that's where the concept of N comes in here. That's called as a non-judgmental. What it means is being non-judgmental about the experience that we are going through is the key. Once we acknowledge and accept the feelings, emotions, or thought that we are going through, often we don't need to go further, because accepting is understanding, okay, this is what I am feeling at this point of time. Many a times when we have these thoughts, we don't really know that we have those. It just feels like it's ingrained and that is the reality. So once we accept it, investigate it, it brings us to a comfort level. Yes, I have this. What can I do more after this? So being non-judgmental about the experience holds the key to regain and maintain the balance between our sympathetic and parasympathetic system, and hence it helps to reduce the stress because our limbic system doesn't get hijacked. But when we struggle and fight, like, why am I in pain? Why this has happened to me? I'm the only one who's suffering from this. I used to do so and so on this before, now I can't do. This leads to pain catastrophization, and pain catastrophization has three main characteristics. One is rumification, repeatedly telling ourselves, like, why am I going through this? Why it happened to me? So rumification, magnification of the problem. Oh, I've got bad back. I can't bend forward. If I bend it, I pay for it the entire day. Or if I do one this, I'm done for the day. If I walk from my home to mailbox, I'm done for the day. It gives me pain. I pay for it later. So this is a magnification that they have developed over the period of time. And then the third factor is the hopelessness. When you see these three things, we need to make sure we sit down with our patient and explain these are not the positive coping strategies. We need to explain them how pain works. We need to explain them why they continue to feel quite a bit pain. And that's where they can gain some control over their thoughts, their anxiety, to reduce that hopelessness, to reduce the pain catastrophization. There's plenty of research that they say pain catastrophization is highly linked to the central sensitization, where even a sub threshold level of nociceptive input causes the same amount of chronic pain that they have been living every day. When they sleep, they have pain. When they wake up, they have pain as if they slept with the pain, and it's just terrifying. Yes, pain is our friend because we need pain for survival, but we don't want to make pain as our best friend. So realizing the experience that they are going through, being just aware of certain emotions or pain or feelings or thoughts, and not giving too much importance about it being positive or negative emotion, positive or negative thoughts, it helps to keep our autonomic nervous system in check, and it helps to rebalance the sympathetic and parasympathetic system. I hope this makes sense in helping your patients regain some control over their thoughts, over their emotions, for pain, anxiety, and so on, to reduce their suffering from pain. Thank you so much.